Hi, good afternoon. Dr. Garima here again. And today we'll be solving one very important question for the Australian Dental Council exam. And this question is also important because definitely one such question would be asked. And today's explanation, I am dividing it into different three different YouTube videos just for you all to understand it better because I do understand as an undergraduate student, especially in the subject of oral maxillofacial surgery, you are practically never exposed to something called as condylar fracture or subcondylar fractures. We just read through books. If you're really like lucky and and you are posted in the department in the internship and you get to see a postgraduate performing condylar fracture or some Lefort 1, 2, or 3 fracture surgeries, great. Then you have a better idea. But otherwise, just as a student, it's just pretty much theory, and you actually never get to observe or participate in a surgery that is being done to fix. Even the first year postgraduates are not allowed to do all these surgeries. It's just the second or the third years. The first year postgraduates are pretty much, I think, restricted to third molar impactions and disimpactions. So yeah, so I can understand. But of course, when such questions are asked from the clinical perspective, then you get a bit lost. Also, of course, you don't revise the fractures and everything once you pass your internship. So anyways, let's just brush up quickly through with a series of 3 short videos which will enhance your understanding about the condylar fractures, and it would help you to answer any question related to it. Okay, already about the splints and the TMJ, I have made a beautiful video which I think almost 4-5 thousand views are done with likes. It's a very simple video about splints. Go watch that. One part of your exam with related to splints would be done on that. You can just write TMG splints and Dr. Garima on YouTube and you can get that. And one other part of the oral surgery subject I will be covering here right now. Okay, so let's start. I would like you all to first understand that the mandibular bone is like any other bone in the body except for some few unique specifications. But after all, it's a bone, so any fracture that can happen to it, pretty much it is under the same classification as what happens to other bones in the body. So this is just a small video about the common types of bone fracture. Because once you understand the classification of the bone fracture, it's very easy to determine the treatment. The problem only happens when you're confused about what type of fracture that is, right? So let's just see here. So the first is transverse fracture. A transverse fracture is basically a straight horizontal line. Like in a straight plane, the bone has fractured. In that scenario, if the bone is just fractured straight and it's not displaced, you can just join the bone back with a closed reduction. Closed reduction meaning you don't have to do any surgery and you just pretty much immobilize the jaw and expect the area to heal. Like sometimes, you have a plain elbow fracture and the orthopedic just positions it and no surgery and just splints it. Same way here. So that's a pretty much straight. Now, if it's a horizontal fracture and the two bones are displaced, then you may require repositioning or you may require some surgery to position it back and then you immobilize it. We'll come to the part of how to immobilize it also. So that is first type of fracture. Transverse means pretty much a straight horizontal fracture. Now, open compound fracture. What is an open compound fracture? It means it's broken and the bone fragments are out open in the skin. So it's a gross picture but pretty much looks like this, you see. So the bone fractured and by the force or the pull of the muscles in the wrong direction, whatever, it just torn away the skin and it came out. That's called as an open compound fracture. Okay, then we have something called as oblique fracture. Oblique, by the name itself, the fracture line is oblique, like that, exactly. Now, in that oblique fracture, let's see, there are 2 varieties. One is a displaced fracture and one is a non-displaced fracture. Now, example, you have a condyle and it got fractured. You remember you have read the unfavorable fracture and the favorable. That is regards to the obliqueness. Now suppose the muscles, now the joint has the pterygoid muscles, the masseter muscles, the temporalis. Now if the fracture is in such a way that the muscle pull is maintaining the fractured fragments in their own place, and though it is an oblique fracture, that's a favorable fracture. So you don't have to intervene, you just have to like close the area, like immobilize the face, and pretty much the fracture site heals. Unfavorable oblique fracture means what? It's exactly this picture out here. So because of the muscle pull and it's an oblique fracture, the muscles are attached. So every muscle has a origin point and an insertion point, right? Now suppose my origin point is here, my insertion point is here, and this fracture. So my insertion point is going to be pulling that fragment towards itself, correct? Now that will become an unfavorable fracture. So depending on how the obliqueness of the fracture is, if it is unfavorable, then the fractured segments have moved apart. Then you have to intervene with an open reduction method or do something to oppose them together and then fix it, okay? So this is called as an unfavorable oblique fracture. Then what do you have? You have comminuted fracture. Comminuted fracture is basically the bone is broken into multiple pieces. Exactly like this. It's very, you definitely require a plate fixation or something to it, you know. Then you have a segmental fracture. Segmental fracture means there are more than two fracture lines, and then there is a bone segment which is just hanging out there. So again, that would be a open reduction, because when you have more than two fracture lines means you have to make sure that each line is opposed properly. You'll have to do an open reduction, like you'll have to open the surgical site and see and then oppose and put plates and stuff, you know. This usually happens in very high-end trauma cases or road traffic accident cases or a fall from a big height, you know. Painful things, you know. Green stick fracture. Green stick fracture is a partial fracture. So the bone is completely not broken, but it's partial. Mostly happens in young children, you know. So you just kind of stabilize that area and expect the fibrous tissue, etc., to form there and heal that area. Spiral fracture. So in the spiral fracture, the bone breaks spirally. So it looks like oblique, but it's actually a S-shaped spiral line. Like the fracture line will be like this, you know. So mostly in a twisting motion or something like that. Again, that would also require a proper open method, unless it's really favorable and you can close it, you know, properly. Now, avulsed fractures. Avulsed fracture is due to, you know, the muscle pull. It usually happens near the joints, and it can be due to severe spasm of that muscle, or you are doing some kind of exercise and you just bend a muscle in a very wrong direction, that wherever it's attaching a small piece of bone, it will just yank it away from its place. You hear the term, my knee got dislocated, my joint got dislocated, you know. So a dislocation is okay, but if it's a severe pull, it can result in a fracture as well. So these are the type of fractures. Now that you know this, whenever somebody is going to use a term called as a compound fracture happened to the face or a comminuted fracture, you can immediately imagine what kind of fracture that would be and what most likely the treatment would be, right? See, all this information will just make you a better clinician. You'll be better equipped to answer questions asked by your patients, or even in your family or friends, you know. They will look up to you when you have a proper explanation and not say, you know what, let me just Google up. You are the Google, you are a medical professional. Yes, I do understand that you cannot know everything, but whenever you come across a good genuine information or a required amount of information that should exist in your brain to qualify you as a doctor, that should be at least there, correct? The rest is you upgrade and upgrade and upgrade. Nobody in the world knows everything, but when you have technology to explain you so many things, might as well learn whatever you can in the right way and impart it across, correct? Now let's go to another video. Now this is a proper condylar video. Now I just want to show you how a fracture of a condyle, which is completely displaced, is fixed. So in very simple terms, if the two bones are like pulled apart, you take a screw and a plate or just screws and you fix it. Now this definitely requires a surgical intervention. You cannot just close the mouth with a splint or something and do it, right? Now this area, I also wanted to show you all this video is, this is the head of the condyle. It can fracture here like which it had, or the fracture line can be just here, which is a subcondylar fracture. Why am I emphasizing on this is that in the exam when an x-ray would be given and if you see a fracture line out here, don't jump to answer it's a condylar fracture. The condyle is a condyle and there is a subcondylar region which is like a neck of the mandibular bone, you know, out here. So imagine this is the neck and this is my head. So my head is a condyle and my neck is subcondylar region. So if somebody cuts my neck, that's a subcondylar problem, not my head problem, okay? So many people make a mistake, they mark the answer as condylar fracture and then when it's wrong, they'll be like, what went wrong? This went wrong, you used the wrong terminology, correct? Then, yeah. It's a very good presentation by this person in a maxillofacial surgery department, but I'm not going through the entire thing. I'm just going through a short one, which is how would you fix it, you know, the treatment. It's reduction, it's closed and open. We already spoke about it. Fixation can be directly skeletal or indirect skeletal. The same chart is present in your oral maxillofacial textbook, but I'm just going through it. Direct skeletal fixation can be internal with a wiring, plating, bone, which I just showed. Or it can be external pin fixation. Indirect skeletal can be through an arch bar or a wiring, like it's kind of braces, but you know, it's very deeply wired and you just cannot move anything and just with a straw you have to consume, and then immobilization. So with regards to how each one looks like, you can just Google up. If I try to do that, the video will become really long and then you'll be bored. I try to limit my videos for less than 20 minutes or so because that is the capacity of the brain to catch your attention, right? So yeah, this is nice. You can pause and go through it, make a chart out of it, the most simplest thing. And you can go through this guy's video. I always like to give credit to everybody who's made nice videos for your help, you know. Nobody's making a video for our help, it's for you. So take advantage and just see that video. Now, having understood all these things, let's go back to solving the question of today. A 27-year-old young man, angry young man, presented to your department early in the morning and he's looking for a checkup and treatment after a blow to his face. Now, after taking his medical and dental history, you found that he's an alcoholic. So he drank last night and can't remember the accident details, but he suffered a blow to his face. He had attended the surgery department last night. Okay, so he doesn't know what happened. Probably he got drunk, and I don't know why people get drunk. Like they stop, they just forget how to behave. It's the alcohol then who does everything. I don't understand, why do you want to lose control of your brain and self? Anyways, people are people. So one more thing I want to add here is something called as a contralateral blow to the condyle. Now suppose if somebody punches me here, this condyle will get fractured, okay? So a fracture on my right side is going to, no, a blow to my right side will fracture my condyle on the left side. Remember this. So if you get a question saying the patient claims that he remembers having a blow on the right side of his face, which area of the condyle can be fractured? It would be the left, not the right. Understand? If the blow is on the center of the chin, both can fracture. Okay, remember this. So yeah, according to some Australian medical guidelines, how many drinks per day is a maximum recommended dose for a male? Yeah, this question was actually asked in the exam, okay? So I've not made it up. You have to know this. And it's actually mentioned in TG also, the therapeutic guidelines. 4. The answer is 4. How many milliliter of alcohol are in one standard drink? 12.5 ml. This much, I guess, yeah. Posterior anterior view of the skull, identify the abnormalities. It's a PA view. Now when you see here, you can see the mouth is open. So whenever you take an x-ray, you always ask to bite, and there is a uniform level of radiolucency between the upper and the lower teeth. But this is like, basically the mouth cannot close. So some problem has happened, and you can see here. You see this nice fracture line? Now, definitely this is unfavorable fracture. It's a displaced one. You can see the bones are not together from this aspect. So yes, it is displaced, it is oblique. Now, would I classify this as condylar or subcondylar? Think. The answer is subcondylar fracture. So many people in my mock answered this as a displaced left condylar fracture and got it wrong. This is not the condyle. The condyle is way up here. This is subcondylar region. You understand? So please take a deep breath. Be very calm. Do not make silly mistakes like this. Your exam is very expensive. Your time is even more precious. And your frustration would kill you if you come to know later on that you marked a simple answer, the wrong one, and made a silly mistake. So don't do that, okay? So definitely this is a left subcondylar fracture, a displaced one, yes, but it's not a condylar fracture. So listen to the keywords which are mentioned here. Displaced left condylar, subcondylar, body fracture, Amos fracture, left condylar fracture. It is not condylar, it is subcondylar. So the answer is B, not A or E. Understood? Now, what is the treatment of choice? See, the ideal answer for this should have been a displaced left subcondylar fracture. But you see how nicely they have mentioned displaced, and you'll be like, yes, it is displaced, let's mark that, don't do that. Now, what is the treatment of choice? Soft diet, that's a maintenance part. Closed reduction, I don't think so. I think it should be open reduction. And intermaxillary fixation, elastic intermaxillary fixation. Okay. Treatment of choice according to me is open reduction. But in your exam, if the X-ray shows that the two parts are approximate to each other, you can choose closed reduction. Okay. Now out here, see the X-rays that I have given. I of course I do not get anything from the Australian Dental Council exam, the question paper or something. We can just approximate the same X-rays and then make the question which is already there asked in the exam. So I think when this X-ray was given, in that probably it was closed reduction. So in my mock I think I have marked the answer as closed reduction because I had immediately formulated this paper after that. But if I see an X-ray like this, I will go with an open reduction answer. So even if you mark closed reduction or open reduction in my mock, it's okay. But just see the X-ray because it's based on the X-ray that you're going to form the answer. But looking at the way the mouth is open and cannot be closed, and you can actually see on the X-ray the open line, I would go for an open reduction as the answer. Alright. What is the most common long-term complication? Most common. Most. Again a keyword, again a repetition. If I remove the word most, it becomes what's the common complication? It means all the options that would be given would be correct. There is no right, there is no wrong. It's all are correct. You have to choose the most common. What is the most common? TMJ dysfunction. Loss of balance and malocclusion are common, but the most common is TMJ dysfunction. Which side TMJ dysfunction? The same side where the fracture has happened. Which side fracture has happened? The left side. Hence the answer, the left TMJ dysfunction. Understood? This is how you solve the question. Now to solve such a question in less than so each question you have approximately 1 minute 20 seconds to solve because you have 70 questions to be solved in 2 hours, and you have a big scenario to read and solve 5 sub questions to it. To answer a question correctly in this less time, you need to be very well versed with theory. So yeah, brush up your theory, read your concepts. Only when you know the concepts you can solve the question. So I hope this was helpful, and leave your comments to all the new candidates who are watching this video. How do you get in touch with me? Because this is what you keep on writing in the comments. How do we get in touch with you? ADC written mock test at gmail.com. I'll write in the description. Just copy paste that, email me, I have 28 mocks, more than 1000 questions. Can you study all by yourself? Yes, you can. You just need the mock papers to prepare and solve and read therapeutic guidelines and ODEL and infection control. And you need to have your concepts clear. So, this is what you need. And yeah, have a nice day. Bye bye.